So welcome everyone to this convocation reception for the 2020 graduates of the Medical Radiation Sciences program. My name is Kate Palmer. I am the director for the Medical Radiation Sciences program in the Department of Radiation Oncology at the University of Toronto. And I want to welcome you and your families to your virtual convocation reception and awards ceremony. I will be your MC for this event. But before we get started, before we officially get started, I just want to orientate you to the Zoom platform for those of you that have not used this before. We're all placed on mute when you entered the room, and we'd like to encourage you to stay on mute so that the floor will always be with the speaker who is obviously speaking to the graduates. But please feel free to switch on your cameras so that you're able to see your classmates who I suspect you haven't seen for a very long time, maybe 3 or 4 months now. So please switch on your cameras and wave and do whatever you need to do to get yourself noticed. Throughout the awards ceremony, please use the chat function. You'll notice that there are a few people already chatting away, congratulating you. But congratulate the award winners. There's also a function along the bottom that says reactions. Please use that as well when we get to the awards section of the event, and clap and congratulate your fellow colleagues. We're going to be monitoring the chat, so if you have a question, please use that, and like I say, we're monitoring that. One final piece of housekeeping for all of our award winners. Your certificates will be in the mail once we are allowed back onto campus. So it could be a couple of months before you actually see your certificate in real life, but we will get it to you as soon as we possibly can. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit. This sacred land was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. The Medical Radiation Sciences program is a fully integrated degree diploma program between the University of Toronto, Department of Radiation Oncology, and the Michener Institute of Education at UHN. And our program educates students in the fields of radiological technology, radiation therapy, and nuclear medicine. On behalf of the University of Toronto, I would like to introduce you to Dr. Patricia Houston, Vice Dean, MD Program in the Faculty of Medicine, to say a few words to our graduates.
So thank you, Kate. So the first thing I would like to say is congratulations. It's been a tough road. You have not only done well, but survived, particularly in these last few months where we all had to pause the clinical environment and sort of flip your programs on their heads, so to speak. And yet you still met to the competencies, you have the skills, you have the attitudes. You are ready to graduate and go out into the healthcare world. And as I congratulate you, and I thank you for doing so, for doing all that work, and thank your family and friends, I would like you to think about 3 things. And those are the importance of resilience, the importance of kindness, and the need to find joy. So why is resilience important? It is a skill that helps you to get through difficult times. And certainly the past few months have been difficult for many of us. And you will find as you enter the hospitals now that it's not the hospitals that you went out of, but in truly a new abnormal healthcare system. And more than ever, you'll need to be resilient. And being resilient means that you develop and understand a set of core beliefs and values that you live by, that you reach out to others and ask for help. You're not in this alone. You try as best you can to maintain a positive attitude, even when the going gets rough, and you find a role model or a mentor who is also resilient and you learn from them. Face your fears, don't dwell on your failures, and learn to reflect. Look for every opportunity to learn, because one of the most important attributes any healthcare leader can have is to be a lifelong learner. To quote Ernest Shackleton, you have to have moral courage. You'll need to be optimistic in order to have a better future, and you'll need to be courageous to be the champions of change. So you're going to have to be resilient, but you're also going to have to be kind. And part of being resilient was being kind to yourself. So on top of being kind to yourself, you need to find those moments, those small moments when you are kind to others. You need to listen, not just with your stethoscope, but you need to listen with your heart as well. So kindness and compassion help us at a time of crisis to develop productive and meaningful relationships and to find value in the work that we do. And so if you share your own vulnerabilities with others, if you are empathetic and kind, you will be able to face your fears in an authentic way. And you will be able to deal with the pain, stress, and anxiety that you're going to find out there more than ever, actually, right now, as our very sick patients come back to the hospitals. And you'll be able to focus on how you are going to help others and what you need to do. So those two things haven't sounded too uplifting, but the third one I hope will. So the third one is about joy. So when I look back at my career, I have been joyous. I truly consider it to be a privilege to take care of others. And so you are now going to have that opportunity in your career to take care of others. And I hope every day in some way that you find some joy in your clinical world. So if you think about the needs for resilience and kindness and how you can help yourself to find joy every day, I know you will have a long, successful, and satisfying career. And again, congratulations. I would be remiss if I didn't finish by thanking Kate Palmer and Fifi Lee for all the work they have done to make this program the best it possibly can be, and for all of the preceptors at U of T and the missioner for the work they do every day to give you a great learning environment and wonderful clinical experiences. So thank you and congratulations.
Thank you, Patricia, and thank you for those joyous words as well. Dr. Brian Hodges is the Chief Medical Officer and Executive Vice President of Education at University Health Network, who will now bring wishes to our graduates on behalf of the Michener Institute of Education at UHN. Thank you, Dr. Hodges.
Thanks, Kate. I'm just confirming, am I clear?
You are very clear, thank you.
Oh, very good. Okay, well, wonderful talk from Patricia Houston, as it would be. Patricia is modeling everything amazing about responding to this, being both an exceptional leader and frontline in COVID, and for some of you watching her on social media. And that takes me right to my theme, which is what the world and the healthcare system is asking of us, all of us right now. And I wanted to echo her comments that we're doing it together. People often say we're in it together. In this program, it's a collaboration, and our partnership with University of Toronto and Michener Institute is very strong. I'm also grateful to Fifi Liu and Kate Palmer for leading an exceptional program. You know, you're graduating at an extraordinary time. I think they say something like the only two things you ever remember your whole life is your marriage and your graduation. So, but this year, I wonder if graduation is going to be something indelibly burned in your mind. This COVID period, the good, the bad, the ups and downs, has been extraordinary. And I would first of all give you kudos just for getting through it. We've asked people to endure with a lot of uncertainty in the last months. The staff at U of T and Michener have had to rapidly convert exams, do virtual things. You've had to adapt to different virtual settings, to being at home, and really this is amazing. But I want to point out that it sets a tone for something you're going to need a lot more of. The future is uncertain. COVID, I don't know. No one can predict. It's probably with us for 12, 18 months, maybe years. And at the same time, as Patricia was saying, we're trying to bring back surgery. We're trying to ramp up cancer care. We're trying to do everything. And you're going to enter workforces. You are entering workforces that are disrupted, that are uncertain, where there's a lot of unpredictability. And so actually, I think this period of a few months, as unsettling as it has been for you, is probably a good preparation, because you're going to experience that every day for months or maybe even years. So resilience, Dr. Houston talked about resilience, and that's very true. But I also think in addition to resilience, you need a certain flexibility and creativity. And I like to think that together, the U of T and Michener, we've helped you develop that. I'll just give you examples that I see in the system. You know, in our world, we suddenly, overnight, were told that people who had never been in critical care were going to work in ICU. And within 48 hours, we had to help people prepare for that amazing transition. And then one day, I got a phone call saying that we were being put in charge of 20 long-term care homes. UHN has not got experience with long-term care homes. And all kinds of folks from transplant and surgery and others, some of you maybe, helped us with long-term care homes. And then one week we were told that 2 hotels were being turned, hotels, 4 Points Sheraton, were going to be a new place to care for people who are homeless, who had COVID. And so, although those things on one hand are frightening, they're anxiety provoking, they're disruptive, they're also the source of immense creativity. So you're living through a period of time where the healthcare system.
Oh, did we lose him?
Am I back? I hope
Yes,
so.
you're back.
My whole system crashed. That was the fastest reboot. Talk about, you know, illustrate my point, right? Fastest reboot in history. Anyway, blah, blah. I was just saying that we're all under enormous pressure and enormous creativity, and you've been through it and you will continue to be through it. The last point, though, that I want to make is gratitude. Every year I say this, and I want you to just think through, usually we do it in the room, but I want you to just think through and remember to say thank you to a few people. The first is your family, and more than ever, your families and friends have helped you get where you are. I want you to remember today and in coming days to say thank you for that. Each other. We have had to learn to support each other in a virtual way that is really challenging. And don't forget to thank your colleagues and your friends who will be there hopefully for you for the future. But also, I love our faculty, both U of T, Michener, all the clinical sites. But this year, honestly, they have done absolute backflips to try to make sure that your education can be robust. And I would myself say thank you to them, and I hope that you'll take just a word or two, an email, a text, something to say thank you to the amazing faculty that have helped you get here. I look forward to you being our colleagues. I look forward to some of you meeting you in UHN or in U of T or Michener, or wherever we see each other. And honestly, this is an enormous milestone for you. I'm sure you're very proud. We're very proud of you, and congratulations.
Thank you so much for those words of wisdom, Dr. Hodges. So the reason we're here is to congratulate the MRS class of 2020. A nuclear medicine technologist prepares and administers radiopharmaceuticals either by injection, orally, or by inhalation to safely detect disease in its early stages. Nuclear medicine technologists image different organs and bodily structures using specially designed cameras, sophisticated computers to process data and enhance images. They are a vital component of the healthcare system. Please congratulate the nuclear medicine technologists for the class of 2020. A radiological technologist plays an integral role in the detection of injury and disease. They are the medical personnel who perform diagnostic imaging examinations, including mammography and computerized tomography. They are responsible for accurately positioning patients and ensuring that a quality diagnostic image is produced. Radiological technologists have been on the front lines of the fight against the COVID-19 pandemic, caring for and performing chest x-rays and CT scans on COVID-positive patients. Please congratulate the radiological technologists for the class of 2020. A radiation therapist uses cutting-edge technology and advanced computer systems, allowing the simulation and planning of treatment for cancer patients, and ensures the accuracy and effectiveness of treatment delivery. Radiation therapists counsel patients on potential side effects from treatments and provide advice on how best to minimize these effects. Because radiation treatments often extend over several weeks, a special supportive relationship often develops between the therapist, the patient, and the patient's family. They work closely with patients, physicians, and other health professionals as part of the interdisciplinary healthcare team. Please congratulate the radiation therapists for the class of 2020. Congratulations to the whole of the class of 2020. And now for the fun part. This is the award ceremony. And so we would be remiss if we didn't hand out some awards. The first awards are bestowed upon those students who have achieved the highest cumulative grade point average for the entire 3 years of the program. The gold, silver, and bronze medals. For the class of 2020, the bronze medal winner is Tiffany Chi Yi Chung from Radiation Therapy. The silver medal winner is Paranavi Zaravanathan from Radiological Technology. I see someone taking photos there, so I'll leave that one up just for a minute. And the gold medal winner, sorry, Tanya, you ready? Okay, and the gold medal winner is Matthew Atkinson from Radiation Therapy. Congratulations to you all. That's a lot of work and a lot of hard work that brought you to this award of excellence today. In the final clinical year of the program, students have the option to complete a clinical project or a research project. The research project involves the student developing a research question, searching the literature, gathering data, and producing a thesis. And while I make this sound so simple, I'm sure those that have undertaken this course will tell you it is a lot of hard work. Over the years, the standard and caliber of the work has continued to exceed our expectations. The honorable mention for the research award is Tina Wu, Radiation Therapy. Tina's project was entitled Predictive Models for Neoadjuvant Chemotherapy Response in Breast Cancer Patients Using Quantitative Digital Pathology Imaging Biomarkers. The 2020 Outstanding Achievement in Research Methods goes to Joshua Francisco Torchia from Radiation Therapy. Joshua's project was entitled Deformable Registration for Accurate Recontouring and Total Planned Dose Records for Patients Undergoing Adaptive Replanning. Congratulations to you both. For those students who choose not to complete the full research project, they complete a clinical project instead, and those students with the highest overall mark receive an award of excellence. The honorable mention for the clinical project in radiological technology is a tie this year. So I would like to congratulate Cecilia Howe and Subhangi Thangaraja. Cecilia's project was entitled, Will the Utilization of Electronic Requisitions in the Emergency General X-ray Department Improve Patient Wait Times when compared with handwritten requisitions? Subhangi's is CT colonography a better alternative? I can't read it because the chat box is up. Ah! I can't read. Okay, I've got it. Okay. Is colonography a better alternative for detecting colon polyps or colorectal cancer compared to a double contrast barium enema examination? Congratulations, guys. The winners of the Outstanding Achievement in Clinical Project for Radiological Technology, and again, this is a tie, Patrick Brown and Madeline Pristansky. Patrick's project was entitled, Is Medical Imaging Overused in the Outpatient and Emergency Departments at UHN? And Madeline's was, I'm just going to take that up there, the effectiveness of ultrasound-guided versus fluoroscopy-guided shoulder joint injections in adults with arthritic glenohumeral joints. And I think I said that right. Congratulations, guys. The honorable mention for the clinical project in radiation therapy is Michael Aitchison. Michael's project, can the use of 10 MV photon energy for volumetric modulated arc therapy reduce organ at risk dose compared to 6 MV photons while still maintaining comparable planning target volume coverage in low risk prostate cancer patients? And I think he wins that just because the length of the title is so long. The winner for the Outstanding Achievement in Clinical Project for Radiation Therapy is Harneet Makur. Harneet's project was Can concurrent hyperbaric oxygen therapy aid in diminishing acute radiation tissue injury seen in locally advanced breast cancer patients who have undergone a lumpectomy or mastectomy? Congratulations, guys. The honorable mention in research informing practice for nuclear medicine is Andrea Isabel Maria Vaz. Andrea's literature and protocol review was entitled DTPA Renal with Blood GFR, a fusion of the Gates and blood method. And the award for outstanding achievement in research informing practice for nuclear medicine goes to Megan Summers. Megan's project was entitled A Procedural Guideline Proposal for Low-Level Exercise Oh, you see, I messed it up. I did it great in practice. Yeah, stress first, myocardial perfusion imaging. Congratulations, everybody. We have one set of awards left, and that's for our volunteer awards. Every year, we have outstanding individuals who volunteer their time and efforts, and often working behind the scenes to help promote and represent the MRS program as ambassadors for their fellow students, faculty, and academic community. The Medical Radiation Sciences Volunteer Award recognizes the exceptional contributions of all of these 15 students who have supported the medical radiation sciences at the University of Toronto in some capacity over the last 3 years, whether it was with recruitment events, assistance with our admissions process, or contributing to conference events. They all have represented themselves and the program proudly. So congratulations to all of our volunteer awardees. and congratulations to you all. The Department of Radiation Oncology in the Faculty of Medicine has academic oversight of the Medical Radiation Sciences program. It is now my pleasure to invite Dr. Fifi Liu, Professor and Chair, Department of Radiation Oncology, to conclude the virtual awards ceremony for 2020.
Thank you so much, Kate. So good afternoon, graduates, family and friends, faculty and fellow dignitaries. Thank you to everyone for attending this very special occasion to celebrate our Medical Radiation Sciences graduating class of 2020. First, congratulations to all of you. You have achieved an incredible milestone in your journey into our healthcare sector. Your clinical training and your program have not finished exactly the way that you or we had anticipated, but nonetheless, we know that after years of hard work, dedication, perseverance, and resilience, you are well poised to take on the workforce successfully. You will become a member of this constantly changing and complex healthcare environment, as you have just heard from Patricia Houston and Brian Hodges. But do not let this complexity deter you. Use your education and training to embrace the complexities that you will encounter. Use your training and education to help you to make the right clinical decisions that's going to improve the clinical outcome for the patients that you will be looking after. And also embrace the complexities to seek and uncover new opportunities for yourself, your colleagues, and your patients as you move to advance your careers and really discover the fulfillment of your chosen vocation. You have witnessed firsthand through this COVID experience that as essential workers, the healthcare system needs you now more than ever. And you also know that you're joining an important sector of our society whose contributions are deeply valued by everyone around the world. So congratulations also to all of our award winners. Under normal circumstances, we would be celebrating your additional achievements in person, in the debates room at the Hart House with a lovely afternoon tea. Pictures would be taken as you receive your awards and your names unveiled on award plaques. But that's not happening, obviously. However, when life returns to some semblance of normalcy, please drop by our UTDRO office to see your names emblazoned on the plaques hanging on our walls. As we conclude this afternoon's virtual celebration, on your behalf, I would like to thank our amazing faculty members for their immense contributions to the education, training, and mentoring of our graduates as they help you prepare for your future professional careers. And I would also like to take this opportunity to thank the members of our UTDRO office for organizing this virtual celebration of your achievements, working tirelessly in the background, ensuring that our students and graduates have a seamless experience. I thank Kate Palmer, Kian Tan, Tanya Webb, Brett Snyder, Sarah Galache, and of course, Evan Donahue for all your hard work throughout the years. Thank you all once again to our graduates, family and friends, faculty and honored guests for attending this afternoon's virtual event. Graduates of the Medical Radiation Sciences class of 2020, we're all so proud of what you have accomplished, and we all look forward to watching your career unfold in the years to come. So once again, thank you all for attending. Congratulations, everyone. Stay well, stay safe, and have a lovely afternoon. Bye-bye.
Thank you very much, Fifi. So once again, We'd like to congratulate you all. Please keep in touch, and we wish you all the best. Have a wonderful evening and stay safe.